It is a great pleasure to welcome to Larry King Live Dale Cochran, the widow of the famed attorney, the late Johnny Cochran. Also with us is Dr. Keith Black, one of the major figures in neurosurgery in this country. He's chairman of the Department of Neurosurgery, director of the Maxine Dunitz Neurosurgical Institute at Cedars-Sinai, and he was Johnny Cochran's doctor. Later we'll get into a major discussion about cell phones, and we'll include our own Dr. Sanjay Gupta. Johnny died March 29th, 2005, of a brain tumor. This is Dale's first interview. Since then, what indication did he give you that something was wrong?
Initially, there was a loss of memory. He asked his secretary to call me and get me on the phone because he just couldn't remember the phone number to the house. And
did he dismiss that or get concerned?
I got concerned right away that he couldn't remember my telephone number, and we immediately went to see a doctor in the next day or two.
Is that memory loss a major cause of concern, Dr. Black?
Larry, memory loss can be a cause of concern. I mean, any function that the brain is responsible for can be a symptom of a brain tumor.
So you should check it out?
So
any symptom?
Any symptom related to memory, speech, vision, movement, headaches. One of the most common presenting symptoms in an adult is new onset seizure, as well
like
as headaches,
Kennedy had.
Similar to Senator Kennedy's.
Johnny Cochran probably was one of the best-known attorneys in the United States. Not probably, he was one of the best-known attorneys. He was a celebrity in his own right, a great friend of this show. We have a little montage here for you. Watch.
It makes no sense. It doesn't fit. If it doesn't fit, you must acquit.
We, the jury, in the above entitled action, find the defendant, Orenthal James Simpson, not guilty of the crime of murder.
The resolution of this case is in no way an admission of guilt by Michael Jackson.
This is a great, exhilarating victory for Sean Combs. It's a victory really for all of us.
Thank you for your attention. God bless you.
The night after the Simpson decision, Johnny guested on this show. It was his historic moment because O.J. Called in during that show. How did he become your patient, doctor?
We were actually, Larry, close friends. We had actually vacation together and summer vacations with our mutual families. And actually, before he developed the tumor that was ultimately more aggressive, I was treating Johnny for a more benign tumor a few years before.
In the brain?
It was in the skull, yes.
But that was not a death signal.
That's correct, and it was unrelated to the subsequent tumor that he developed.
How did you find out what he had?
I actually received a call from Johnny's assistant, as Dale indicated, concerned about his difficulty with memory and also some difficulty with speech. He was in New York at the time and had been admitted to a hospital in New York. They had performed some studies, MRI scans. They saw an abnormality within the brain. They were not sure what the abnormality on the MRI scan demonstrated. I initially thought it might be an infection. And I spoke with Johnny and also with Dell, and they flew back to Los Angeles where we did further diagnostic studies.
Did you have to do a biopsy?
We did a biopsy, yes.
Dale, did you know he was terminal?
I don't really like to use the word terminal. I knew that he had a very serious malignant tumor, but I didn't look at it in terms of being
Did he
terminal.
know how serious it was?
We knew it was serious, but we thought it was treatable and that, we'd work our way out of it.
What was the treatment? They had surgery, right?
Initially, Johnny's tumor was in an area that is considered not safe to operate on, Larry. It was in an area that was critical for his language. In fact, very similar, I presume, for Senator Kennedy's, that is responsible for both his ability to comprehend and understand language as well as memory. So surgery, at least to try to remove all of the tumor that we could see on the MRI scan, was not one of the initial treatment options. So that option wasn't one of the weapons that we could use to fight the tumor.
But later you did use surgery, right?
later, as part of an experimental protocol, we went in and did surgery. Yes.
We all like Johnny. I don't know anyone who didn't like him. Defense attorneys who opposed him, prosecutors. Yes. You had to like Johnny Cochran. Mm-hmm. What were his last days like? Did he die at home?
He died at home. The whole family was there, all of the kids, and myself, his sisters, his father, who's lived with us for a number of years.
Still living?
He's still living. He still lives with me. He's 91 years old, I'm pleased to say.
Did Johnny know he was passing?
It was a very quiet period of time. And, again, we knew it was serious, but we were trying to keep him as comfortable and maintain a good quality of life for him in the last days.
Doctor, is there pain involved in this?
Larry, typically no.
No.
The brain has no sensation. It provides sensation to the rest of the body, but this is not a painful process.
Do you see, Dale, as a lay person, the possibility of cell phone use and Johnny's illness?
I think perhaps there could be, but as a lay person, I have no scientific knowledge that there is a definitive link.
People at CNN who saw a lot of him said he was on that phone a lot. Is that true?
Yes, he was on the phone a lot, but as Dr. Black used to say, use an earpiece when we're using the cell phone.
That's the simple solution to this? Don't, instead of your phone, attach an earpiece to the phone.
Attach an earpiece immediately.
All right, Dr. Black, what do you make of the possibility?
Well, Larry, I think if we look at the evidence that we have now, it's difficult to say that cell phones have a direct link to brain cancer, but it's also difficult to say that they're safe. There have been studies that have come down on both sides of the issue. If you look at some of the studies that have been performed, I mean, one of the studies that is very concerning has been a study out of Europe that looked at a long-term exposure to the use of cell phones over a period of 10 years. And when patients or people were exposed to over 2,000 hours of cell phone use, which is about an hour a day for 10 years, that study reported about a 3.7-fold increase in the risk of developing brain cancer.
That considered high?
That's considered, a significant increase, although the overall incidence of brain cancer is low, but there have been other studies to show no correlation.
What do you read, Dr. Gupta?
Well, it's interesting because you look at all the studies out there, and most people will say, look, I mean, they're fine. A lot of scientists will say that. But, I've read all these studies, Larry. I mean, I've spent the last year sort of really reading this, and there's 16 really good studies out there, a few since 2000. Most of them, if you really dissect it down, they really only follow the patients along for just a few years. And, people use their cell phones for years and years, and kids start using them. They're going to use them their whole lifetime. Also, some of the studies say regular cell phone use is using it one time a week for 6 months. I mean, who uses a cell phone that little nowadays? So my point is this, that if you read the studies alone, they'll say they're safe. But if you start to say, well, look, wait a second, how about if it's 10 years? How about it's 20, 30, 40 years?
We don't know yet.
We don't know. And if you use your phone all the time, like people in the news business, they have a cell phone to the ear all the time. Is that really safe?
Doctor, I know it's true, having interviewed many, many people on the subject of tobacco and lung cancer. Mm-hmm. We can't tell you why tobacco causes lung cancer. We know that it causes lung cancer by the statistical rate. Mm-hmm. You think we'll have a statistical rate to link these two?
Well, I think, as Dr. Gupta said, one of the big concerns that we face is that there has not, Larry, been a definitive study to date. And I think particularly among young people who are logging, thousands of hours of teenagers and even younger, and they will be using cell phones for 20 or 30 years, we do not have enough data now to say that, that is a safe device. Unfortunately, my suspicion is that it's going to be 5 years or 10 years before we have a definitive answer. And unfortunately, as you showed at the beginning of the show, there's 1 billion people, that will be using cell phones, and they will be using cell phones over many years. We don't know that will necessarily be a safe practice.
Dr. Gupta, Dr. Black says it's possible. Do you say it's possible?
Yeah, I do. And you know, when I was researching for the book that you and I talked about, I looked into all of this. I started researching it and really understanding it. And I think when I had kids, I became even more interested in it, frankly. And I think it's possible. I think it's, you know, it's one of those things where, you know, I use a cell phone all the time. Most people do. I use an earpiece now, as Dale Cochran talked about. But